tuning in to Artisans Rejuvenation Med Spa. This is one of our instructional videos. We are going to do a vampire facelift on Amber. Now Amber's young, so a lot of people ask, why would I need a vampire facelift when I'm young? One of the things that we can do with this is correct some asymmetry. We're not all perfectly symmetrical, but some of us have a little bit more asymmetry than others. And Amber has a little bit more fullness on this side than on this side. So what I'm going to do is I'm going to give her a little bit of volume here and a little bit less of the volume here, and also put a little bit of lift in her temples and her cheeks. And then the PRP, which is here, it's already been separated. This is, we took her blood and we spun it down, and this is the plasma, platelet-rich plasma. And the platelet-rich plasma is rich in healing proteins, particularly something called platelet-derived growth factor, if you want to Google it. But it helps with the healing. It helps with collagen promotion. It also helps stimulate some of the fatty deposits inside the in the face. So we're going to do some deep injections as well as some superficial injections to help with her complexion and help with her asymmetry. Amber, how you doing?
I'm good.
Now these markings that you see here, those are for my benefit. They're for me to follow the golden ratio patterns, and where I'm going to try to get a little bit more lift in other areas. She's also numbed up with both topical lidocaine and some a little bit of lidocaine with epinephrine, so that she doesn't feel much. She was telling us earlier she couldn't feel her eyes. So I think you can see okay, right?
Yeah, I can see. It's like my eyelids. It's really funny.
Okay, so that's the best part, is when somebody thinks they're being funny. So, like I said, she needs a little bit more volume on the left and on the right. I'm going to do a little bit of hyaluronic acid injections to give her a little bit of cheek volume. And then after that, I'm going to do the PRP and a little bit more of the injections as well. Okay? You ready?
Mm-hmm.
So, little stick here. How does that feel, Amber?
It's just like pressure. It feels fine.
Feels fine?
Mm-hmm.
Okay. So I do, like I said, she's already numbed up, and there's also some lidocaine in the product. This is one of the Juvederm products. And she's doing really well. And not too bad so far. Okay, I'm going to go to the other side now. It's a bit of a challenge to walk with these glasses, but I can manage. Now she needs a little bit more volume on this side. Now one of the things that we did before this is we took some pictures of Amber and different, by the way, she's our lead medical esthetician, and she's seen me perform this numerous times, and I think she's had a few facials, but she thinks she's getting older. I think her skincare analysis showed that she was 24, so she was very happy about that. Sorry. You doing okay?
Mm-hmm.
Okay. And Brittany, could you hand me another one of those blue, the needle? The other one?
Here.
Mm-hmm. Thank you. This is empty.
Oh.
She gave me
That
the
wouldn't
empty
be
one.
helpful.
A little bit of
Okay,
comedy
there you
relief.
go.
That was intended, guys. That was not an accident. That was by design, right, Brittany?
Yes, I meant to do that.
Okay. So we changed the needles because they get dull after a few pokes, and especially since, don't freak out, but this actual injection is meant to go all the way down on the surface of the bone. Are you feeling anything, Amber?
A little pressure.
Just pressure.
Mm-hmm. Nothing crazy.
Okay. Put a little bit more here. So the needle, like I was saying, gets a little dull after a while. And these markings, by the way, they will come off. They were made with permanent marker, but they will come off with simple alcohol swipes. Wipes, I mean. Okay. So then massaging a little bit. Now the other thing I'm going to do is I'm going to put a little bit of volume on her temples. The temples are often forgotten, and what we do with the temples is that we do get a little bit of a lift, and as we get older we lose volume in the temples. So we're going to do a little bit of the temple injection here. Ready?
So for those of you who have just joined, we're doing the vampire facelift. So let us know if you have any questions. We'd love to answer.
No pressure. And Amber's not feeling very much, are you?
Like I said before, it's just like pressure.
Yeah, for those people that get freaked out with needles,
As long as you close your eyes, you'll never know they're needles.
and there is lidocaine in the product.
So what's the difference between a vampire facelift and a vampire facial?
With the vampire facial, we just do microneedling. We do microneedling in different sections of the face, and actually Amber performs those. And then we take the PRP the same way, and we rub it onto that area that was microneedled, and the plasma helps heal, and is driven deep into the skin. Do you want to add something to that, Amber?
It helps stimulate collagen growth. It helps with texture. It helps with post-acne scarring. In fact, Brittany had one done just recently, and she looked amazing. And, well, she still looks amazing, but
Oh yeah, it just gives you that youthful glow and
Yeah.
makes your skin like so much more radiant as well.
All right. So this is the plasma that I'm going to inject. So the vampire facelift, we just described the facial. The facelift involves actually injecting deeper into the skin, as well as the fillers that I just used. So I am going to inject her here. She's going to look a little swollen, and that swelling is going to go away over the next couple of days. Actually, by tomorrow she'll look back to normal. even later tonight. Okay. Spread it out. You feel that there, Amber? Okay. It's going to give her a little bit of volume. She's doing really well here.
So for those of you interested in the vampire facelift or facial, we do have specials, and they're good through August 31st, so make sure to give us a call and take advantage of those.
Now I'm going to inject a little bit more of a filler. Okay. This is the more superficial filler that I'm going to put here, and this is going to work with the PRP. Give her a little bit more volume and raise her.
Okay, so Dana asked, how long does it typically last?
The effect. This may last depending on which fillers we use. This may last a year, may last longer. We do recommend doing, after doing a facelift, maybe doing a facial every few months for the skin to preserve the complexion. And then maybe doing another facelift every 1 to 2 years. And it depends. Some people may need more. Some people don't need as much. It just depends on the individual. But about once every 1 to 2 years. We could do it every 6 months if the person wants to. This is your own blood. It's very natural. It's not going to give you a very fake look. It's not going to give you a fake look, period. And the swelling that you see now, you're starting to see some swelling there, but this is about, this will come down, but she's starting to get that lift already. And Amber, if you want to take a look, I'm going to let Amber look and see what that side of her face.
Wow.
She said, oh wow.
I'm excluding that right there.
Yeah, that's going to go down.
Oh, wow.
Yeah. Okay. That some of that lump is the lidocaine as well. All right.
I know,
You
it's
want
just hanging out.
All right.
Yeah, that looks awesome.
Okay. Okay, now on this side, she needs a little bit more volume. Remember we talked about the asymmetry. She needs a little bit more volume on this side of her face, so we're going to do that.
I'm feeling that.
You're feeling that? Okay. You feel that there? How's that doing?
Yeah, I'm starting to feel things over there.
And I know there's a lot of blood here, but it'll go away. None of this is just the swelling. You feel that? I'm going to give her a little bit.
Yeah.
Okay. So I guess we'll go ahead and sign off. Do you guys have any last words?
We are going to post her before and afters on our Facebook page. I'm going to finish here, and this is going to probably take me another 30 minutes or so to finish up with her. And then we'll put her her before and afters online over the next day or so.
All right.
Okay, probably tomorrow or
Yeah, I'll keep
day after tomorrow.
I'll do some update photos on my personal page and then on Artisans.
Yeah, we'll have her on there so you can see the recovery time. But by tomorrow it won't look like she had anything done.
So stay tuned for some awesome before and after photos. Take care of that asymmetry and any dull looking skin. Alright, well our number is posted, so give us a call and schedule a consultation or go to our website and give us a call.